Hello, I am Miss Kinan. Welcome to Maternity Nursing 2. Today the topic is cultural sensitivity in reproductive system disorder. So the objectives of today's class are to describe the cultural sensitivity and the concept of the healthcare system for patients with reproductive system disorder, where we learn to manage pain before and during menstruation, and how we seeking referral help from the maternal and reproductive health service system based on local culture, and what's the techniques for providing health education to the families about family planning program based on the local area, and then how is the healthcare system for patients with reproductive system disorder. So before we start further, we have to understand what is culture. So culture is actually the belief or values that learned and shared and transmitted from one generation to another generation in particular group. So these values will guide the thinking, decisions, and actions of the group, and especially in pivotal event or important event in their lives, such as childbearing. Ethnic is what we call group characteristics such as religious, racial, national, or even culture, and can be in the form of speech patterns, social customs, or physical characteristics. And this built ethnicity, where the conditions of belonging to a particular group that share the same race, the same language and dialect, the religious faiths, traditions, values, and symbol, as well as food preferences and literatures and folklore. So in life, we can witness the behavior of a person, but we never know how deep is their history, their values, their beliefs, and their religion. And actually, that's something that we learn as we continue to take care of the patients. What we can see is only their behavior. So, for example, by blood, I'm Japanese, but because I was raised and born and have even ID from Manado, I always tell people that I'm Manadonese. I am not Japanese. So that's how ethnicity. Sometimes we see the behavior is something, but we have to really focus through who you are deep down. Think about a lot of cultures in Indonesia. Think about Batak, Jawa, Bali, Manado, Ambon, Papua, Kalimantan. Some of them is keturunan Cina, like Chinese descendants, Arab descendants, or even mixed culture, mixed race, because their father and their mother are not from the same country. So think about that, how this will shape a person in their cultural behavior and beliefs. So culture in nursing is very important. We have what we call transcultural nursing, where we consider culture needs, which is sensitive to each individual families and groups in our nursing care. So what we do is we have what we call culture specific, and what we also have a universal culture care. So, culture-specific care and culture-universal care. In culture-specific care, we consider the values and beliefs and the unique something that we have in a group. And a culture-universal care is we refer to what is the values that commonly share, what is the belief that is commonly shared, how's the behaviors that commonly share. For example, at this moment, some of you do your clinical practice within the hospital in Tangerang or in a midwife clinic, right? And then you observe that everyone greet each other with Assalamualaikum, right? And then suddenly you begin to, oh yeah, also try to say Assalamualaikum, because that's what's universal here. That's the commonly shared values and belief that they're doing. So I will try to do that too. And then we also observe that, oh, although we are Christian, but we understand that their belief is when they're shaking hands, they cannot touch their hands. So you will just have your hands in front of your chest and bow down to greet them. So that's how you consider the belief and the values and the behavior. So that's culture specific here. Okay, so what is cultural sensitivity? So cultural sensitivity is when we as nurse, healthcare professional, we learn, we recognize, and we comprehend the cultural factors that shapes the family perceptions of their health and health-related event. So that's what we call cultural sensitivity. So we become sensitive to their culture, which also become our nursing assessment tool, that we have the cultural competence to really recognize their culture. So as a nurse, we become open and receptive. We be aware and respectful for the cultural influences. Locsin 2002 mentioned that actually interventions in nursing that based on the valued and practices of the patients, it's actually increase the successful outcomes for the family and patients. So as we nurses, we acknowledge that the patients have their own value and beliefs, and we try to accommodate that into our care. Our care become better, and that's also increase our relationship between the nurse and the patients, which also promote a positive health promotion activities. So once we recognize that one patient has another culture than the other patients, then we acknowledge, we become sensitive about that. That makes nursing care excellent. But when we are not sensitive, we don't want to engage, don't want to acknowledge that, that makes the relationship between nurse and patients become difficult. And even for nurse, as we provide care, it feels like so heavy that we don't enjoy providing the care to our patients. And also the patients can feel that the nurse is reluctant to provide a better care for me. So, what is a cultural prescription and cultural prescription? So, cultural prescription are actually the beliefs or the value that the people understand what they can do, they should do. And in a cultural prescription is actually what they cannot do. Well, we can consider this from the elements such as clothing, exercise, sexual participation, disciplinary efforts, dietary habits, roles and relationships, verbal and nonverbal communication, cleanliness, illness remedies, as well as displays of emotion. So we can see the people, probably Muslim lady came to our facility wearing all covered, only we can see the eyes, and we got confused, but then we accept her and we try to acknowledge that, oh, how can I help you, how can I do the tefe, how can I do the vital signs, how can I assess your abdomen, can you open because I want to see, things like that. So as we consider also those patients who cannot receive transfusion because just they don't believe on transfusion, or in a culture where Japanese, for example, we cannot talk women, we cannot talk to too loud, um, we cannot talk by seeing other people's eyes because it's disrespectful, especially to the father. We cannot say our desire, we cannot talk about what we want. But like meanwhile in the other culture, like for example in Manadonese, you can talk about it, you can talk freely to your father, you can ask, you can say, oh, this is what I want, what do you think, can you accept it? So it's kind of different in every cultural beliefs. Now as a healthcare professional, what cultural considerations that we have to understand? In some culture, we have to understand that women and children do not have the permission, the decision power making, the um, and even the access to healthcare system. So we have to understand that if we see women in our healthcare and they are actually living far away in their rural area and they are here, it means these women have the permission to come, and it's something that we have to treasure. And what about the immigrants? For example, they're immigrants from Suriname, and they came to Indonesia to seek refuge, and then they have the legal barrier. They don't have their permit, and they have also the language barriers because they don't speak Bahasa. They only speak English and Arabic. And what about the healthcare workforce? Can they accommodate when they are sick? Can they communicate? What can you do? And we also have the cultural barrier where some of the women really have a limited access for modern health care. So if in this condition, for example, those are in Papua, so remember that because those in Papua, they don't have always the resources to come to the Jayapura to get the medical help. So Siloam built a lot of Siloam clinics in Papua. And I still remember one of my students told me that she is helping a woman in delivery and the baby is not crying, but then she cannot touch the baby. She just be there not doing anything because in the culture nobody can touch the baby except the mother. So the baby was not crying after being delivered, the baby being put into the bag and being hanged, and that's what it is. But then the father wants you to help the mother, but you cannot help the baby. So what you do, you be there. So in the situations like this, conditions like this, what can you do as a nurse? You can help the family to identify their needs, their strengths, their resources, help with coping mechanism, and also what they desire, like what outcome do they want. And you can also understand that at these situations, you cannot do nursing action. You have to collaborate with the family and you have to plan together. You have to delegate what you need to do. You have to do the collaborations with them, coordinations, and still be there to provide the care. So we have to be really careful when we are passing the cultural consideration. So these are pictures from Papua, from Siloam Clinic Papua IG. So you can see this is one of our alumni. He is giving health educations to the mother and the children about nutrition, and this is how they assist them in stunting in nutrition program. So you can see if the mother came like this, it means that the father has the trust for the mother to come and help the baby. And as you can see, they can have more than one child, and that's the mother's role to take care of the children. So just a consideration that in setting like this is really precious because you have your patients, your female patients who are allowed to come and see the help at the clinic. Well, in cultural consideration, we also need to understand that there is what we know as complementary alternative health medicine, or CAM. Well, if you notice this picture, this is how we do kerokan or coining. Yeah, maybe we know it as coining. So when we don't feel right, we do the coining and then suddenly we feel relief. We are better now. So in setting where the modern healthcare cannot be assessed, affordable or available, we use what we call complementary and alternative health medicine. And here we focus on high touch, not high tech, but high touch. So high touch means that it's non-invasive, it's non-intrusive, it's non-traditional intervention, and we support the family and child's in the whole mind, body, energy, environment, and spiritual healing. So we do the approach from the holistic philosophy of caring with the aim that we want the patient to have the goal of patient-centered autonomy and also have the sense of well-being. So remember when we don't feel very right, when we feel like we have cold, probably have infections, but then we do coining. After the coining, we will say like, now I feel so much better. But actually, the sickness is probably still there, but we do something that increase our autonomy and the sense of well-being. We feel better after that. What we need to understand what we need to understand is actually the CAM needs to be connected with EBP, so evidence-based practice. So what we need to do is the interventions in CAM can be from guided imagery, aromatherapy, imagining, creating art and writing, prayer, chanting, meditation, channeling, therapeutic touch, stroking, cuddling, acupressure, tai chi, magnetic forces, massage, music, singing, tonal vibrations, and various water therapy, as well as storytelling, joking, and humor. And these all are the interventions that we can do, and we have to understand that we have the responsibility to encourage evidence-based decision making. So we have to understand that the CAM is actually promoting health according to the evidence-based practice. So we have the evidence-based practice, we question the intervention, we examine the intervention, we confirm the intervention has the healthy outcomes to the patient. And as a nurse, we use computer databases, current literature to really see if this is safety, have the quality and credibility to give a better intervention to the patient. For example, this one we talked about previously about coining karokan. In Chinese tradition, we have what we call gua sha. So gua sha is actually using something to stroke on your skin. If we read the definition, gua sha is a traditional healing techniques that aims to create taiki on the skin for a believed therapeutic benefit. So we can see that these are really the same culture, the same thing that we are doing in Indonesia, coining, karokan. But then they explore for the scrapping therapy. What does it have? Like, how's the evidence base? Is it really good? Or how is it for immune system? Okay, so we do the evidence-based practice, so we help the patients to understand that, oh yeah, you're doing that and that's good, that's really evidence-based, it's promoting healing, so then we acknowledge the culture in our care. Next is about menstrual disorder. As we are learning maternity nursing, we understand that as a woman, we're going through menstruation. And in menstrual disorder, we know three conditions: menstrual cramps, dysmenorrhea, and then premenstrual syndrome. So menstrual cramps happens because contractions of the endometrium, because there is contractions and we have high number of prostaglandin that increase all the other um, responses towards pain, and this can be in 1 or 2 days and according to the menstrual flow. And we also have what we call dysmenorrhea. So this is a painful menstruation that affect the women, and what we can do to provide health teaching is that we have to understand that this is a natural process, and we can use relaxation and breathing techniques. We can use heat pack to reduce the contraction. We can have exercise and rest. We can also use the non-steroidal anti-inflammatory drugs to inhibit the productions of prostaglandin. In some women, dysmenorrhea can also include pelvic inflammatory disease and endometriosis. So when this condition happens and the pain is very severe, we have to refer the woman to see a healthcare provider, an OB/GYN or a midwife, or even to see us, and then we can assess more and then refer to get more help. There are also conditions that we call premenstrual syndrome or PMS. So this commonly happen in adolescents. These symptoms range from irritability, mood changes, to fluid retentions, heart palpitations, and visual disturbances. So as I mentioned before, this is caused by the fluctuations hormones of estrogen and progesterone during menstrual cycle, and sometimes it also causes the woman to have a lot of alterations in the carbohydrate and metabolism and hypoglycemia. And the recommendations is to do a life-changing style. So we encourage the adolescents to exercise, to eat well-balanced diet, to have adequate sleep and rest. Treatment may necessarily be done when it is really problematic syndrome, problematic symptoms such as we can use diuretics, we can also give NSAID, we can use oral contraceptive, we can use also depressant, antidepressant, and vitamin supplements. Notice that the oral contraceptive and the present antidepressant needs to be prescribed by a doctor. So what can you do? Actually, when you have pain before and during period, you can apply the home remedies. You can do the heat, you can do the massage, exercise, relaxations, and even supplements. You can also do some medications. You can have pain relief, non-steroidal anti-inflammatory drugs or NSAIDs, and you can also have hormonal contraceptives. As I mentioned before, the hormonal contraceptives needs to be prescribed by the doctor. And what else can you do? You can do other consideration to sleep and rest, to reduce your stress, and notice that period pain is something that is normal, and with a good care you can get away with the pain. So what are the ways to ease your menstrual pain? You can use hot water or a heat bath. You can eat nutritious food. You can take supplements, magnesium, zinc, B1, and you can limit your consumption of caffeine, carbonated beverages. You can drink turmeric. You can have warm water with warm water for bath with Epsom salt, and you can drink more water with infusion water can, and you can also have exercise. You can increase sleep. You can even consume more green tea and also apply essentials oil if that's helped you to ease the pain. Well, in some culture and country, menstrual health hygiene is not something that they focus on. Some of the country they really think that when women have menstruation it's a taboo. So we are trying to make a holistic approach by making sure that they are available for menstrual material and supportive material in the private and the social enterprises, that the market will make it easy for women to get, that they have their facilities of toilet and bathing facilities to clean during the menstrual period, as well as we need to make them understand that hygiene is very important and there's special norms for it, but we can work on it to make it's an uh, priority in the menstrual cycle of the woman. When you go through this website, you will understand there are a lot of country they're still battling about the menstrual hygiene. So what's the priority areas that we need to have is the education. We need to educate about we need the water, sanitation, hygiene services, about the health, that it should be affordable and easy, accessible for sanitary materials, the pads, tampons, the menstrual cup, and we also promote gender equality because some country or some culture, when the woman is having menstrual, they are unclean, they cannot go to school, they cannot go to work, they have to stay home. That's some of the consideration that we need to make sure that the gender equality is happening. So then we make sure that the women will be able to access affordable menstrual materials, and also we are not contributing to the large amount of global waste. As we can think, like each month we are bleeding as a woman, and then we throw a lot of pads, right? And how can we make sure that we don't give pollution to the environment with the global waste? Now, as we are in Indonesia, we have to learn about how to seek referral help from the health services on the local culture. So we can see we have bidan desa, we have midwives, we have the polindes, and then we have the Poskesdes, Pusat Kesehatan Desa, Pos Kesehatan Desa, kemudian we have Puskesmas Keliling, and then we have Puskesmas Pembantu, and we have the big Puskesmas. So it's like the community health center. Like the smallest is the clinic for the midwife to practice, and then after the clinic we have like the post where the midwife is having a monthly meeting for taking care of the whole village, and then we have where it's a standby place for healthcare, and then we have the Puskesmas. It's like not just the village but a district, and then we have another district to help and another bigger in a city. So if you can see here in the village we have Posyandu, layanan terpadu. So it's like Posyandu, Polindes, and then Pondok Bersalin Desa, and then we have Puskesmas Pembantu, Puskesmas Keliling. We have physician and midwife practice private clinics. Then we have the healthcare center, and then we also have the Rumah Sakit Rujukan in the district, and then Rumah Sakit Provinsi, and then Rumah Sakit Pusat, like the one in Jakarta, RSCM. So every hospital from all over Indonesia will refer the patients to that hospital. So this is what it is in a scheme. So the family or the community have the posyandu or pospindu, then puskesmas pembantu, puskesmas, rumah sakit tipe C, rumah sakit tipe B, tipe A, the lowest, then begin to become the biggest hospital. And we also have the private practices. Now talking about reproductive and disorder in women's health, we are talking about contraceptive. So we are talking about family planning, where we avoid pregnancy in a family, and actually avoiding pregnancy means there is no sexual intercourse and no pregnancy. So this is just a review from last MN1. So we learn about the types of contraceptives, which one is more effective, which one is less effective, and as a nurse, we need to know each method, what is the advantages and disadvantages. We know the barrier, what is the advantages and disadvantages. We also know the natural family planning, the advantages and disadvantages. So what are the contraceptive? These are the pictures of all the things, and you can learn and make sure that you understand why we need to understand as a nurse, because some of the culture they are not allowed to use of this, and some of the culture thinks that this type of things is taboo, but we are actually doing something when we are giving health education to the family about family planning. We are doing our role as counselor and educator. When we are counseling in a contraceptive, we know what the type, we know the reason, the benefit of the contraceptive. We tell them what to do, how to use it, what to do if there's an error, what is emergency contraception, what's the backup methods, how to change, and the questions and the concerns that they have. So in family planning, we actually give the educations on how to spacing children, but they can have their right pace to choose which one they want. But in keluarga berencana or family planning, we want to improve the well-being of the family. We want the family to be happier. We want to lower the number of death for mothers and baby. We want to try not to have unwanted pregnancy. We want to improve the maternal health. We want to have a spacing pregnancy, and we also want to improve the health of the children, as well as we want the children to have enough breast milk during their coming up. In Indonesia, we also teach about this to adolescents in order to provide reproductive health, and we also know what we called 4T. So 4T is too young, too old, too much, and too close. Yeah, it's like too much. So the baby, the mother is either too young or too old, the child is either too much, and the space is just too close. You can see the videos I put, you can learn from it and understand what you need to do. So this is the system of referring patients. So you have the patients here with the BPJS or national insurance, and then you can go to the first primary health facility, which will refer you to the hospital. If it's emergency, you can just go straight to the emergency, and then you can claim the prices later at the office. So what they do, we come to the first level, which will refer us to the second level. After the second level, they will refer us to the third level. If your condition is really worse, not good, that your patient is not well, so from the first level, they will straightly let you go to the third level, so then you can get more care in the system. So this is what we know as BPJS Kesehatan. So you have the first facility, primary health care, and then you have the advanced health care, what you need to do. And this is what you need to do for non-emergency and emergency. Okay, so this is all from the BPJS Kesehatan Instagram, so you can try to understand. Next, the assignment for discussion is that you need to read these two websites and give your opinion about menstrual health hygiene related to one culture or country of your choice, and what can you do for this health issue. And another one is about contraceptive in culture, so you need to read about this contraceptive and how is their perceptions in its culture and what can you do to promote family planning. So that's the material for this week. I hope you enjoy learning, and these are the references. Thank you.